From the campus of Yale University, this is Business Talk with Jim Campbell, nationally syndicated across the country on the Biz Talk Radio Network and coming to you from our flagship stations, Yale Radio WYBC and 1490 AM WGCH Greenwich. All talk and all business, 60 minutes of radio with leading figures from the world of business along with the business of politics and sports. The man that built GE Capital, reinvented NBC, transformed the nonprofit world with Autism Speaks, now takes on a deadly cancer in honor of his lifelong partner and spouse. Bob Wright establishing the Suzanne Wright Foundation to battle pancreatic cancer, the only cancer that's not improved its survival rate since the war on cancer was established by President Nixon. My bets on Bob on this are going code purple today. And then we'll speak with a professor from the Kennedy School of Government at Harvard who claims Trump's education pick is a win for public school parents. We'll talk some school choice. That's all today on Business Talk with Jim Campbell. Bob Wright served as CEO of NBC Universal, GE Capital CEO, Vice Chair of GE, and he and his wife Suzanne co-founded Autism Speaks after their grandson was diagnosed with autism. He was on our show recently for his book, The Right Stuff, From NBC to Autism Speaks, for which we were honored to have him as a guest. As mentioned, welcome, Bob.
Thank you. Thank you very much. A pleasure to be here.
All right. Let me ask you this. You must have discussed how you were going to take this on as a mission with Suzanne before her end. Did that happen? What was her thinking?
I was with Suzanne for 9 months.
Yeah.
As she slowly died. And we tried everything possible, including many physicians involved, 3 different institutions, hospital and institutions, 8 different doctors, and lots of science and genetics and others, and we were not able to keep up with the cancer. And the tools to monitor the cancer on a regular basis are so crude and ineffective. That's another issue, just even the monitoring.
Surprising.
There are no curative treatments for pancreatic cancer. All they have is a handful of highly toxic drugs, and those chemos are terribly upsetting to most patients. And the reason is because there is a kind of a membrane-like material that surrounds the pancreatic cell, whether it's cancerous or not. It protects the pancreas, which is really a chemical factory making highly dangerous chemicals which provide enzymes and are slowly administered by the liver to break up food. That's a problem, and the chemos, therefore, have a very low yield, and they're killing tons of good cells to get a fraction of the bad cells, and that causes another problem. So I went through all this with her, and I was amazed to find that the number of people that are dying, the percentage, 92%, has been the same for the last, we thought, 40 years. I was currently informed it's 50 years. And if you think in one particular case, you don't need to have any understanding of the science at all. The scoreboard, when you're dealing with mortality, is to get it down. And not to have it move in 50 years means that for 50 years of funding, the NCI has failed each year. Any failure in a couple of years would call into question their methodologies, or call into question the idea of what they're trying to do. None of that happens. And Congress has tried to give them more money, but giving them more money hasn't made any difference. It's the same as it was 50 years ago. So I find that horrible. Now, here's the issue. A lot of people now are trying to independently put together large sums of money to go after it in some more organized way. The NCI refuses to participate in those. It likes instead to give small grants to hundreds of people. That's what they've been doing for years and years. That policy may work in some other cancers. It has not worked with this one. And it really has to be stopped. It's just like it has to be stopped tomorrow. And if I had my way in life, I would say to this NCI, you should be stripped of all responsibility and funding for pancreatic cancer. And it should be given to another government agency that is able to deal with in leadership prioritization in an emergency basis, something like that. That's what the CDC does. That's why you see the CDC taking on things like the Zika and others, and they develop a vaccine in 8-10 months. It's remarkable.
How could there be no accountability in 50 years? Have they been monitoring these guys?
Once you're inside the NIH in its general, there is no accountability. All they'll tell you is that we're doing the best we can with science. But you sit there and look at this, and you say you fail the test every year.
Jeez.
Well, we have a change of government now.
Yeah.
Donald Trump is there, and we're going to have new people at Health and Human Services. That's technically the organization that monitors this. I have to make my voice as loud as I can. I've got to get somebody to listen and say, we have to stop this. We should be doing $50 million grants to maybe 3 organizations on an 18-month basis. They have to show they're working Mondays, Tuesdays, all day, every weekend. The organization has got some target like early detection. There are things out there that can be advanced, or a curative drug treatment program. And that's, from my conclusion, talking to people all over the country, that's the only way this is going to get done. And there are good organizations that are trying to do this. There's one Silicon Valley building up right now. They're looking to raise themselves $300 million. There's the Lustgarten Foundation, which I was a member of, but I had to resign because they didn't want any criticism of the NCI. Could you imagine this? Well, see, the NCI has a lot of supporters, universities and institutions. They like these $1 million grants.
And they report to the NIH?
Yes, but you have to think these people don't really report.
Yeah.
They technically, and yet when you look at any of them, they say, well, we don't have the authority to do that. The other guy does. The other guy does. And Congress has had a terrible time trying to break that structure down because they're lobbied by the pharmaceutical companies who like this structure because they're not into these terribly difficult programs. They really would like green aspirin, lots of green aspirin, things that people take daily or yearly, or a lot of. That's what they want. That's not what we're talking about. So I'm facing this issue of trying to get it sent to somebody else. Maybe we could have them monitor in some respect. I'm afraid they can't monitor. They won't. But some respects, 3 grants of $50 million, that'd be $150 million. They'd have $30 million left in their next year's budget. Let them take that and grant it to small grants. But somehow or other, they are not in the business of management. They're not in the business of leadership. If they give a $50 million grant and it doesn't work, somebody's going to be held responsible, and they hate that. They don't want any part of that.
And try something different next.
Well, of course. So what I'm dealing with, you don't see big walks of pancreatic cancer because people are all dead. When you have something where 70% of the people are dead in the first year, and the rest of the people are basically dead in the second year. Suzanne's case, she was in the class of 2015. There were 53,000 people diagnosed in her class. As of today, which is now another year has passed since her. We're at the end of 16. She was diagnosed in 15. Probably out of that 53,000, I would say 48 or 50,000 are dead.
Wow. And I remember when you were on, you said that she was 4 months along and she was given a lifespan of 9 months. So I figured, you guys would stretch that out, and it was exactly 9 months. It
was 9 months to the day.
Yeah.
No, I thought we had another year. And by the way, the ending wasn't pretty. It's not like it's ugly. It's very ugly. She was in hospice at our home in Connecticut for several weeks.
Wow.
Jim, I just can't. I don't know that I can make this happen. But I'm going to give it a try because it's so ridiculous. What I'm doing is I'm trying to reach. There's 1 million people died in the United States over the last 20 years. That means there's family left. To try to get those family members representing those 1 million, that could be my army. I need an army to go. Yeah. Congress is really helpful, but they've been not able to penetrate the NCI framework, and so it has to come from Health and Human Services. But fundamentally, it's going to have to come from the White House.
Does NCI have a lot of big successes?
Yes, they have. They've had successes in other cancers. Breast cancer, which gets about $800 million worth of their money,
wow,
has gone down from like 40% mortality to 10%. Prostate cancer is down from men used to be in the 40s. Now it's down to 0 almost. It's 0.07. Every other major cancer has had a significant reduction in mortality. There are a few that don't, but the other one that hasn't had much is lung cancer. But those are smokers. As they die off, that looks like it's getting better, but it's not getting better because they they have some great drugs. It's
That's
getting better.
It gets better because less people are smoking.
Yeah, in this case, pancreatic cancer is growing at 1% a year, and nobody can explain why. We have no understanding of how you get it. We have no understanding of really how to treat it, and yet we have 6,500 oncologists in the United States. They're all on this team. They're all, and many of them are getting small grants, and they all wear white jackets and they have very clean offices, and they're running around, and they have, it's fraudulent. They don't have anything that can really cure it, and only in some cases, if it's detected very early, which seldom happens, is there a way to nurse somebody along for a couple of years.
And this is Business Talk with Jim Campbell. Well, you're hearing the passion of Bob Wright in this tribute he's paying to his wife by going after pancreatic cancer. We'll be back for more. And this is Business Talk with Jim Campbell. More of Bob Wright and the Suzanne Wright Foundation, Code Purple's attack on pancreatic cancer.
So I'm looking at this like a business person.
Yeah.
I'm saying, how could this be? How could this be? Why should these people have one more dollar to spend?
Yeah.
And why can't we find another agency? Why can't we send it over to CDC? Well, they say, well, we've never done that. Nobody's ever had this many failures and stay alive.
You can't go 0 for 50. You can't play in baseball 0 for 50. I mean, something's got to happen.
50 innings without a hit.
Yeah.
It's worse than that.
It's kind of sad.
So our website is accessible through Suzanne Wright Foundation, or it's really the name of the site is Code Purple Suzanne, and Code Purple is a code a hospital code that is not frequently used in the United States, but very much so other places, where it's an indication of the hospital puts this out. It's like a 3-alarm fire to all emergency and all medical individuals within, say, 50 miles of the hospital, saying, we have a situation here which we cannot handle by ourselves.
And that's Code Purple.
You immediately have to contact us, and we'll give you the directions to see what you can do to help us. And the other side of it is, Jim, very few people with pancreatic cancer don't spend much time in hospitals until they're dying. Because the treatments, all these clinics all around the country, it's a very good business.
And it's undetected for so long. That's the problem, right?
It's undetected.
It's too late. It's too late when they find anything.
But they get, these clinics get a patient for, a number of months at a very high rate, which is reimbursed. Generally these people are older, so they're on Medicare. They're very comfortable with this business.
It's like a profit center. Almost.
Well, it's hard. It's awful. But now they have a lot of people in there that are in other cancers that are getting better. So I can't condemn them for that nature. But this particular cancer, it's the worst cancer we have in this country, in the world, and it is the deadliest of all the cancers.
Are there too few people that get it, Bob? Is that a problem? The fact that
it's 53,000 is not insignificant, especially since they're all going to die. I mean, that's a big number.
You would seem like somebody would want to try and take a cure at it. I mean,
well, you would think that their bureaucracy is so comfortable with what they have, and that's my challenge. It's not if this is a true challenge, and I'm doing a great deal of this funding myself, and I hope to come back to talk to you in June or July or something, because at that point in time I will either have had some success with this, or I don't know what I'll do. But I've got to get a new administration a chance.
All right, tell me, the 21st Century Cures Act and the Cancer Moonshot, will this fall under any of that funding?
Yes, yes, and by the way, that bill is terrific, but they have to be so careful, and this is my advice to Donald Trump, that be so careful. It's a total of $6 billion. Five of it goes to the NIH. And that means they're going to spend it the way they want to spend it, and they're not going to have a lot of accountability. And I think that's crazy. That money could be spent, and you'll never know it. So there has to be really some tough arrangement as to how that money gets spent, with reporting, constant reporting on what's going on. Some interested parties that are not directly associated with the NIH have to be monitors of this. It's a real opportunity to see if we can do that, because ordinarily the money's just going to flow to the NIH, and they'll parcel that out in different pieces, and that's what you'll see. And maybe over 10 years they'll get something, and maybe they won't.
Now, Autism Speaks, I think you raised the whole thing over $600 million. Is this the kind of scope needed in this project?
We raised over $3 billion.
$3 billion, wow.
The government money. And I hate to tell you this, but we had almost no ability to control how it was spent. And I never was comfortable with the way it was spent. And they never, ever took responsibility for something, saying, we're going to get this done with this amount of money. And all they did is start the same thing, all these many, many grants. And the grants were usually enhancements of some minor aspect of autism. Now, autism is considerably more difficult to deal with than pancreatic cancer. We know a lot about cancer, and we know a lot about the pancreas, and it's one organ. It's not the brain and the gut and all the things that are involved in autism. But we got the money. We raised money ourselves. We raised $600 ourselves, and the government put in $3 billion. And I wish I could, stand here and tell you that they spent it in a proper way. And we need legitimate third parties out here, and they're forming. And what they're doing is they're saying that it's hopeless to deal with the NCI. And so what I'm doing is saying that shouldn't be the case. This is taxpayer money. They are the ones that are responsible for the research for it. They should be leading it. They shouldn't be in the background fooling around with it, which is what they've been doing.
Only 2% of federal cancer research is dedicated to this. Why is that number so low?
Well, it's this because, you obviously have to sense that when you have this failure rate out there, these people are, nobody's pushing. There's nobody pushing. And when there's nobody looking and nobody's pushing, the money's going to go to those who are pushing. That's why the largest single grants have gone to breast cancer. And you see all the people pushing, all the survivors are pushing, the Komen Foundation, many others. There's a lot of them. And they're all good. And they have really put money on the table for research. And the other one is Alzheimer's. Lately, Alzheimer's has pushed hard, got a lot of government support. There's a lot of people pushing for that. So I'm just giving you two examples.
What about privatizing the function within the NIH or the entire NIH?
That's essentially what I'm saying for pancreatic cancer. If you want to try that, this is the ideal one to do.
So sort of like outsource it as
because they failed. There's total failure. They'll argue that they've had a lot of success in other things, but this one, it's total failure. So I'd say this is a great trial for that. And you'd have people come in. I'm suggesting, $350 million grants a year. That means that there's an organization that's going to receive 50. That organization has to raise a lot of money on itself. It has to be really a solid group. Maybe it's a Johns Hopkins, or maybe it's a private organization on the West Coast which is being formed. There's several. Maybe it's the Lustgarten Foundation working with 3 or 4 hospitals. But they have to accept tough terms. Mm-hmm. They have to have weekly challenges. They have to be showing exactly what's happening, and the hurry up and wait is not what we're looking for.
That's going to have to clearly come from the White House or someplace, or HHS, because NIH is not going to want that kind of competition.
No, and they're not going to want that kind of a process because they would be worried that process may go into other areas. Yeah, like a leaky thing. From a standpoint of the Health and Human Services, this would be the place to try it. And if they really made some progress here, then it would be open to review. Now, I'm not saying there's a lot of science that goes on in the NIH which is not drug related. So that we're not going to hold back on that. You can't get into that, and I can't say that that there hasn't been progress in cancer. There's been a lot of progress in cancer. It just isn't this one, the worst one. So it's me.
Somewhat personal.
I'm the thorn here. And the only group I can really count on here are the families of these million people that died over the last 20 years.
And it's CodePurpleNow.org.
Yeah, it's Code Purple. It's Code Purple Suzanne, CodePurple.org. Yes.
And Suzanne Wright Foundation. That's the web address for the Suzanne Wright Foundation.
Yes,
right?
Yes, but that will get you there too.
Okay. All right, we'll be back, and we're going to talk Trump and a little GE from both Mr. Wright's experiences with Donald Trump at The Apprentice and obviously his role at GE. You're listening to Business Talk with Jim Campbell. Well, you're hearing the passion of Bob Wright in this tribute he's paying to his wife by going after pancreatic cancer.
She initially said, "Bob, don't, you got to move on." And as it came down to the last days in July, and while she was still, pretty cognizant of what was going on, I told her that I said, I really can't. I can't let this go. I've seen this is horrible. Mm-hmm. You shouldn't be in this case. You shouldn't be dying. I shouldn't be here doing this. We have to find a better way. I have to understand why there's been no progress in this, and that's going to be my goal. And she looked at me and she said, "Thank you."
So she obviously signed off on it, basically.
She signed off on it.
What is going to happen with your role? And I know you guys had peeled back a bit on Autism Speaks.
Well, I'm a board member. I'm an active board member. I think I'm still their largest fundraiser, they're moving ahead. They're focusing more on services, which is fine. We did so much of with science. We have a great science program with the Missing Project, which is a $40 million genetics project, which will last for years and years. It's up and running, and it's Google is managing the cloud. We are soon to introduce a portal for average people to be able to go in and to either have their children tested and then have it compared against 7,200 other family members that have autism, which is the largest collection of whole genome sequenced information with all the data of the people that exist for any disease.
The key drivers of success for trying to get this mortality rate down, you're doing awareness, obviously. Do you think, how would you rank this? Do you got awareness, money, R&D, the structure that you've been talking about, the leadership, how to get it accountable? Where do you assess what the drivers are? Well,
I can just tell you, the increasing the awareness for any disease also increases the amount of money that is the funding, the research. They go together, and so that's going to take care of itself. Now, my function here is I'm not raising money itself for research. I want there's money out there already, and it's held by the government entity of the NCI, and that money is supposed to go to pancreatic cancer, and it has been poorly spent, very poorly spent. They have failed for 50 years. So what I'm trying to do is to get that money spent in a manner that shows leadership, prioritization, and urgency. And there's groups of people out there right now that I could point to that would be thrilled to get some of that money in a large dump and work on a very tight time frame, something that the NCI does not do.
And you know something, at 92% mortality rate, if you could get down to 70%, you're already looking like you're delivering a huge incremental improvement. I don't know why they wouldn't want to try and bite it off. You can't do much worse.
If I could get it down to 90, that would be something they haven't been able to do for 50 years.
It's mind-boggling.
What's
fast pass approval process mean?
Oh, there is a process at the FDA, that's going to the FDA, that theoretically allows a drug to be approved on a faster route. It's a very complicated process, though. And I would say that the problem the FDA has, and that's another one, that's separate from the NIH, it's part of Health and Human Services, they need to have a path for based on mortality. They need, if somebody's got a drug that they're trying to test, and it's one of the most recurrent issues. Like the number one would be pancreatic cancer. There's lung, and there's a couple others, so forth, that are more than 50% people are dying. They should be on the front of the line. They shouldn't be mixed in the line with the green aspirin and the better cough drop.
Interesting. We'll switch a little bit, but it could be a good seamless transition because what Trump could do. The last time you were on, and you turned out to be right, you were prescient, you were talking about Trump as a winner, someone that you believed actually had a chance to win. I didn't think he had the temperament or anything. I interviewed Washington Post guys since then who did a book on him, and they think, by the way, that The Apprentice may have been the biggest single thing that built the brand and helped get him to a position where he could actually do this seriously. How do you predict he's going to do? And wouldn't he be the kind of guy that could put some pressure to change the structure over there and get this attack going on pancreatic?
The answer is yes and yes. I think he's going to do fine. I think he's going to do fine. You can see right now he listens to people. He's been taking a lot of advice. He's done a lot of things which are clearly not the normal things that other people would do. And then people step back and say, "Well, that's pretty clever. It's a pretty good idea."
Yeah.
And the second thing is he has Apprentice was certainly a major help for him. There's no question about it. But he's got all that behind him. He's made his money. He's done what he can do in the business world, and I think he's going to be loving the job of being president. And he's going to see every day there's a challenge. He likes challenges, and he as long as he's hiring good people and putting them in a position which he's doing right from the back, I think it could be a extremely successful presidency.
And I've been surprised, frankly. He's put a lot of great people into jobs, including folks that didn't, they always say he's thin-skinned, but he looks like he's trying to do everything he can to be a winner. Well,
he's got a lot of opinionated people now in that cabinet. And now the cabinet, ultimately reports to the president. But these people are all people that are outspoken, and they're not people that are shy. So I think that's going to be very good.
I assume you're not going to be shy to try and get some input on this health stuff, right?
I'm going to do my best to get to the presidential transition people. I think the Governor Pence has done a spectacular job as the vice president-elect. I've never seen in my time a vice president-elect be this engaging and being such a major factor.
I think he's going to be a chief operating officer.
He is, and he's good at it. I mean, you see him when he's with the media and everything. He's unflappable. He's very polite. He gets his messages across, and he's highly organized. I think Trump made another. That was a great decision. And
I don't think he's going to get in the way of Trump's halo too. So he's a modest guy. So I think. Which will fit.
His actions is he's. You could look at what he's done. You just have to say, my God, he's done a hell of a job.
Now, when you knew him from NBC and even GE, because I know GE lent him money in
Yep.
real estate, what did you see that you thought this? What did you see?
Well, I saw a very colorful guy with a great ambition, a lot of ego, but also a person who would work very hard to get to his goals, and he got caught in the late '80s as almost anybody did who was in real estate. It was a very tough period there, and he got caught. He got caught down in with this casinos and so forth.
Yeah.
But he worked it out. And he didn't go bankrupt. He lost controls. He ended up with small ownership positions, but he stayed with it.
Let me ask you this: if you obviously you watch his victories, he's been extremely focused on his self-interest at the expense of potentially everything. Do you think he's going to be able to switch to the national interest?
Absolutely, because his business is going to continue. It's going to be helped just by being president. It doesn't have to do anything to help it, and it's already established. And he has his family members. They are very capable of running it, and they probably will put somebody from the outside, if you will, in charge of that. He's going to enjoy the challenge of being president, and I think that'll occupy his time and attention, and he'll be fully occupied.
All right, let me ask you a couple of questions on GE, because when you were here, you were pretty prescient that GE Capital waited too long to take the actions it's needed. Now they've gone the whole, radical cutting it off, spinning it out. First of all, do you have any? I mean, you were the architect of that. Is there some sadness of what they've ended up doing with it?
Well, it was, because at the time when I was there, it was a heyday. We were really getting large fast, very fast, and we were a tremendous part of GE's success story in terms of earnings. But there was concern then that we were getting too big even when in the early '80s, and that it would be an issue at some point in the future. Now they got very, very diversified at the end, and that diversification was
unmanageable.
Didn't help them. It was unmanageable in a bad economy of 2008 and 2009, and a lot of it was not their fault. I mean, the fact that the debt market was shut down was not their fault, but they suffered immensely for that.
And this is Business Talk with Jim Campbell on the Biz Talk Radio Network, 350 stations around the country, and you can go to biztalkradio.com, find the station nearest to you, listen over the Internet, access our podcasts. This is Business Talk with Jim Campbell from our flagship stations, Yale Radio, WYBC, and 1490 WGCH, Greenwich. More with Bob Wright. Now, I've been impressed because I did a show. I asked GE Capital if they would do, GE Corporate, if they would do a show on this transformation. And not only did they do it, but they were pretty honest that this move to GE Digital and the spinoff to try to even become essentially a software a technology company was a leap of faith. There was no plan B, and they're jumping in with both feet.
Well, this is the difference between the discussion we had about NCI. They're willing, and Immelt's had his issues, there's no question, but he's willing to take the responsibility. And the GE corporate group is taking responsibility. They know they're going to get this is a lot of responsibility. Nobody, I don't know of any corporation that has made this kind of a transition.
Unbelievable.
And it's possible. There's no reason why it can't be done, except it hasn't been done. I think their move to Boston makes a lot of sense. I mean, it's an image issue, but they're plugging themselves into that community. The intellectual capacity in that community is huge, and they are totally committed. So they're also going to have to be held responsible, and they're willing to accept that. I think that's great.
It's well put. Let me ask you a culture question on this. GE, to me, Six Sigma put in their marrow, which is basically zero defects, quality control. In this business, you've got to be in the beta visions. You've got to put stuff out that might not be complete, and it might fail a little bit. Can they make that cultural transition?
They're going to have to, because you're absolutely right in what you just said. Six Sigma was really came about from the chip industry, where they were trying to get the yield.
That's right. Good point.
The yields, and it was, the ironic part is if the yields were running around 30%, and it came down to Six Sigma was a methodology to increase the yields, and the winners with a 2 or 3, Intel was the winner. They got up to I don't remember exactly what it was, 36%, and they wiped out everybody else.
It's interesting that we'll finish up now back on pancreatic cancer, but that point also leads into it because that was a focus on improving the yield, which is the same thing that we're trying to do on pancreatic cancer. One of the facts on your information you put out is 50% of doctors are unaware of clinical trial options. What does that mean? Well,
most of the patients, the people that are diagnosed with pancreatic cancer, are in community hospitals because there's no rhyme or reason to geography either. So they're going to be in community hospitals around the country. And the doctors in those community hospitals generally are not following the potential options for participating in a trial. But the trials are probably not in their hospital. The trials are somewhere else, and the patient may not want to go there, and they don't really follow it. So people are not getting sent
to the right place.
Now, the other thing is the whole concept of a trial for pancreatic cancer patients is ridiculous because they're using the same standards that they would for anything else, for like another cancer, say bone cancer or something. Somebody's going to last a long time, and these people are dying off so quickly they can't support a trial. A trial, if the first phase of the trial is 18 months, you just eliminated all the pancreatic cancer people. So the concept of having trials for pancreatic cancer done that way, you don't have to be a scientist to say that doesn't make any sense.
It's common sense.
you got to have 3 months trials or something like that. You got to have hurry up and speed up. So you make a mistake. These people are dying. They don't mind a mistake.
Yeah. Is there a way people can join you in the fight or give money, or is it just you want them to go to the website?
No, they can. The website is fully functional, and we are able to. We're authorized in almost every state to accept money. We can raise money and funds. I'm licensed, completely licensed. It's a very active site. We also have a connection to PayPal on it, and so yes, we're definitely looking for money from people. I mean, small dollars count just as much as big dollars. That money is going to be used to break through this bureaucracy we have with the NCI, and hopefully, and a lot of I already have 5 or 6 employees I've hired, and it's a lot of work to try to get to Washington, try to get to the people. We've got to maintain a lot of communication with people in the industry that are trying hard. We're really trying to be a bridge between failure and success.
Does this help? Has this helped you get through this by having this passionate mission?
Well, yes, but it's a real weight on me. It would be a lot easier to do what a lot of other people do. I mean, honest people, they just say, this is a horrible thing that happened. I got a nice doctor. They made it as pleasant as possible for her to die, and then they move on. And I just couldn't do it. So if I didn't do this, I would be haunted. And I'm not being haunted now. But I've taken on a challenge here that is immensely difficult to get my hands around. But I know what has to get done, and I just have to find a lot of people to work with me to get it done. You
guys were such partners in everything you did. Is it tough to be on this alone?
Yes, it is. It is very tough.
Are you going to give yourself, I mean, now that you were retired from the corporate world, are you still giving yourself some time to unwind and do stuff? Or is this going to be...
Well, it's right now, it's not so much so.
You may never retire. Anyway, that was Code Purple Now is the place where you can go actually to learn more. It's a cool-looking site, by the way. It is kind of in purple. And obviously, if you want to give some money, I know that, as you just said, anything helps out in this battle. And I would say pancreatic cancer has met its enemy, Bob.
Well, I hope so. I'm going to try the very best I can. The next time I talk to you, we'll see if how much I've achieved. So that's what I'm trying to do.
Okay. Well, I'm really honored to have you in, and have a great Christmas and Happy New Year. And I know you're going to make some kind of dent in this.
Jim, thank you very much for your time. Thank you.